The culinary medicine workshop really highlighted for me the importance of nutrition in our everyday lives and showed me how inseparable food and diet is from our own health.
The foods that we eat greatly influence our overall health, and I'm very interested to see how we can change our diet to affect the progression of certain disease processes.
Was seeing how the food was grown and learning how to prepare and cook local produce, which wouldn't have been possible without the interprofessional team learning approach with the dietetics program. Working with the dietetics team has given me insight into the value of referring patients for nutrition counseling and has shown me the need for treating diet as a modifiable health factor.
Work with dietitians. I knew that they were around, but I never knew exactly what they did and to the extent that they could be a resource for us. So certainly when they are a resource, I know that I know how to reach out to them and that I know that I can and what they can help with. I certainly plan to continue to work with a dietitian, not only for my own personal education, but for my patients. But I do plan on working in a pretty rural area, and so it's nice to be able to further my education as much as I can and to be able to help my patients, but also know my limitations and when I need to send them on to somebody who can help them with more complex disease processes and with their diet. It's very important for looking at ways that we can change the diet before we're adding in medications that can have a lot of deleterious effects. So I think it is very exciting to talk to a patient about lifestyle changes before we're talking about medication changes. Even though it might be harder, it's going to be a lot easier on their body. And I think that it's a lot less expensive for them and a lot better in the long run.
The culinary medicine workshop has shown me the value of food education in clinical practice and has definitely been one of my favorite experiences to date.
I am very excited to continue to work with the dietetics program and continue to further my education, because I think that as I progress in my medical education and start working more with patients and start understanding a lot of these disease processes more and more, I will be able to understand the dietary components and better be able to apply it. So I'm very much looking forward to having more workshops with the dietetics department in the future and being able to work with other interprofessional workshops to further our relationship.